Thanks for joining us. We got to sit down with Dr. Copland from Atlantic Reproductive Medicine Specialist in Raleigh, North Carolina. In this brief podcast, she talks about the types of fertility treatment available to couples who are facing infertility. Let's dive right in. Hello, Dr. Copland. Thank you so much for joining us. Infertility is one of the toughest challenges a couple can face, and there are many different options. Can you take a moment and please briefly talk about the types of fertility treatment available to couples and persons who are looking to begin building their family?
Sure. So we address our fertility treatments to what we find in the evaluation. For example, if we have a couple where the concern is that the female partner doesn't ovulate, well, we try to look for reasons she might not ovulate. Sometimes there's a thyroid problem. Sometimes hormones are out of adjustment, and we can get the hormones in line, and that will help people ovulate better. But many times we're going to need to do something to help with ovulation when women have irregular menstrual cycles. So we women, we're born with every egg we're going to have. We will all go through menopause someday, but when we're in our reproductive years, our brain is supposed to tell the ovary, give it a push essentially to get an egg rolling toward ovulation. And if the signals from the brain are not getting through to the ovary, that's when women don't ovulate very well. Their medications are historically, it was Clomid. We use much less Clomid these days. Now we use a drug called letrozole. And what it does is it drops estrogen so that the brain says, I need to push this ovary harder. And when the brain releases hormones to push the ovary harder, that can help induce ovulation. And get women who had irregular menstrual cycles or even no menstrual cycles at all to have a monthly ovulation and a monthly cycle until they get to, if ovulation is the only factor, that should get them to conception in a similar timeline as folks who are trying for pregnancy who don't have any ovulation problems. So ovulation induction, helping get eggs moving forward, is part of what we do. If that doesn't get us to pregnancy, or if we have the case where we haven't identified exactly why someone isn't getting to pregnancy. She ovulates, he has sperm, fallopian tubes are open, all of the tests look good, unexplained fertility. Then we use these drugs, letrozole, to push the ovary not just to bring forth one egg so a woman can try each month, but to bring forth more than one egg so that there are more players on the field. One egg a month hasn't been getting to pregnancy, so we're trying to push the ovary just a little bit harder. And we can take the sperm and we can wash them and put them up into the uterus right before ovulation. That's intrauterine insemination. And that is the closest we can get eggs and sperm together with working within a woman's body. If we want to get eggs and sperm any closer together beyond that, we need to move forward with in vitro fertilization. So if a woman, sometimes we start there. If a woman's testing shows blocked tubes, she's going to start with in vitro fertilization. Or if a gentleman's testing shows sperm numbers that are so low that intrauterine insemination will not be fruitful, then we start with IVF. And sometimes, more often, it is that folks have tried taking the medications to help with ovulation, doing inseminations. They have not yet gotten to a baby, and so they are trying to fix everything they can fix. And if someone hasn't gotten pregnant with ovulation induction and insemination, there's three things that could be wrong. Either sperm aren't getting to the eggs, or they are getting to the eggs, but they're not getting into the eggs, not penetrating, not fertilizing, or they are getting to the eggs, they are getting into the eggs, but then the embryos that are formed are not of a quality that is implanting into the uterus. And those three things can really only be treated and identified by working with eggs and sperm in the laboratory and doing in vitro fertilization.
Right. Is there anything that you would say to couples who are this is where they're kind of at in their lives, where they're wanting to build a family and it's become a little challenge, and perhaps they've tried different fertility specialists. Is there something that you would say to them to still give them hope and some encouragement on how they can, the more options, the different options that are available?
I think the main message to get to all folks who are trying to build their families is that there is a lot of hope. You know, we are better able to evaluate fertility. We are now in the era when folks are not getting to pregnancy, or when they're getting to pregnancy and they're having recurrent miscarriages. We can actually test the genetics of embryos. We can identify it when folks are placing embryos back into the uterus but not getting to pregnancy. We can actually identify windows of implantation. We have gotten better at testing, and we are always improving when it comes to treatment. So if a couple, is ready to kind of talk through all of the assets they have, all of the challenges, and then talk through the different treatments, there are many tools in the fertility treatment armamentarium that will help. I talked to folks about a toolkit, and so pills to help women ovulate are there, injections to help women ovulate are there, insemination is there, in vitro is there. If there is concerns with egg or sperm, there's egg donation or sperm donation. If there are uterine concerns, there's gestational carrier. There are many tools, and so when we sit down and talk about what is best for them, they need to think not only about the body, which is a lot of what we evaluate and treat, but also about their head and their heart, and that there is a lot of hope. There are a lot of tools to help folks build a family, and I think that would be the main message I would want people to have.
Thank you so much, Dr. Copland. And you're absolutely right. Understanding and evaluating where your head and your heart is one of the most important things to do when you're facing infertility and considering going on the journey of building your family. Thank you so much again for your time and providing insight into the types of fertility treatment available to couples. For more information about the types of fertility treatment and to determine which type of fertility treatment is best for you, please visit Dr. Copland and the Atlantic Reproductive Medicine Specialist online at www.atlanticreproductive.com. That's www.atlanticreproductive.com.